Hey everyone, and welcome to this explainer. You know, if you or a loved one has ever faced a prostate cancer diagnosis, you already know the heavy, overwhelming burden that comes with trying to choose a treatment plan. It's literally one of the most difficult crossroads a patient can face. And frankly, it is perfectly normal to feel totally stressed out about making the wrong choice. So today, we're going to look at it from exactly that angle. We are diving into a fascinating medical paper published in a top-tier journal back in 2021 that looks at a very specific, very human metric: post-treatment regret. Okay, let's dive into this and see what the data actually tells us about the paths patients take and how they feel about them years down the line.
Here's our quick roadmap for today. First, treatment choice and regret. Second, 3 treatments and risk types. Third, low risk, choice without regret. Fourth, high risk, the surprising truth. Fifth, why regret after surgery. And finally, preparation to prevent regret.
All right, let's start with section 1, treatment choice and regret.
So in this 2021 data, we're focusing exclusively on localized, non-metastatic prostate cancer. Basically, that means the cancer cells are still confined right there within the prostate gland. They haven't spread. And we're looking closely at this idea of treatment regret. Now, usually when doctors and researchers talk about cancer data, they're looking at hard, objective clinical outcomes, right? Things like recurrence rates or survival rates. But this paper, it measures something deeply personal. It relies entirely on patient surveys, asking essentially, do you wish you'd chosen a different path? This is a purely subjective measure. And we really need to respect that, because while this isn't, objective clinical evidence of a treatment failing, it is incredibly valid. Quality of life and a patient's personal peace of mind matter immensely. So this data validates those real human feelings while giving us a solid scientific lens to view them through.
Moving on to section 2, 3 treatments and risk types.
To really wrap our heads around the data, we have to map out the 3 primary treatment options and see how they intersect with a patient's specific cancer risk level. It's kind of like a giant puzzle. On one side, we've got the 3 main interventions: surgery, radiation, and PSA active surveillance, which is essentially close, continuous observation. On the other side, we have the cancer's risk classification: low, medium, and high risk, and this is determined by things like malignancy grade or PSA levels. The absolutely crucial point here is that a patient's options are actually dictated by their risk tier. For instance, PSA active surveillance, that's primarily reserved as an option for the low-risk category. If you're in the high-risk category, well, observation simply isn't an option anymore. You're looking strictly at surgery or radiation. Keeping this little matrix in mind is totally the key to unlocking all this data on regret.
Which brings us to section 3, low risk, choice without regret.
Okay, let's put our detective hats on for a second. We're starting with patients whose cancer is localized, very slow growing, and currently presents a low threat. I want you to pause and just think about this. Between surgery, radiation, and active surveillance, which one do you intuitively think left low-risk patients with the least amount of regret? You might think that choosing to aggressively remove or radiate the cancer right out of the gate would give patients the most peace of mind, right? Get it out, be done with it. Well, let's look at what those 2021 surveys actually revealed.
The answer is PSA active surveillance. Yep, observation actually causes the least amount of regret for low-risk patients. The data showed that patients in this specific group who rushed into surgery or radiation actually demonstrated a stronger tendency to experience regret later on. Why? Well, because active surveillance allows patients to monitor the situation safely without immediately subjecting their bodies to the intense side effects of surgery or radiation. For low-risk patients, that wait-and-see approach proved to be the absolute most emotionally satisfying choice down the line.
Now let's turn to section 4, high risk, the surprising truth.
Let's raise the stakes a bit. We're pivoting to high-risk patients now. In this category, the cancer is much more aggressive, and gentle observation is, unfortunately, no longer on the table. The choice basically becomes a heavyweight bout between surgery and radiation. With surgery, the biggest strategic pro is that if the cancer happens to return, you can still use radiation later. It leaves you a backup plan, which is nice. The con, however, is the immediate and severe physical toll, specifically urinary incontinence and erectile dysfunction. On the flip side, radiation has the pro of being an outpatient procedure, meaning no hospital stay is required. But the cons are pretty significant too. It can cause late-onset complications like radiation-induced cystitis or bleeding in the rectum. And strategically, if radiation fails, surgery is generally no longer an option.
So, armed with those pros and cons, let's ask our second question. For high-risk patients who absolutely must choose an aggressive treatment, which one do you think causes more regret? Does the safety net of having surgery first make patients feel better? Or does the outpatient nature of radiation win out?
The 2021 data unveils a very surprising truth here. Surgery clearly resulted in a higher degree of regret compared to radiation. Now, it's worth noting that high-risk patients who chose surgery were generally less regretful than low-risk patients who chose surgery. But when you compare the two high-risk options head-to-head, radiation left patients with noticeably less regret.
Let's explore exactly why in Section 5. Why regret after surgery? So why exactly does surgery cause so much heartache and regret, even when it successfully removes the cancer? Well, the source material points directly to the harsh reality of surgical complications. The primary driver of all this regret is severe urinary incontinence, particularly during that grueling window of the first 6 to 12 months post-operation. Just imagine going about your daily life, trying to recover from cancer, and dealing with significant leakage for half a year or more. It profoundly impacts a person's dignity and their day-to-day quality of life. Alongside this, erectile dysfunction plays a major role too. Because the subjective survey of regret is taken while patients are living with these intense, daily physical reminders of their treatment, it makes complete sense why surgery spikes the regret meter so highly.
But there's a light at the end of the tunnel in Section 6, Preparation to Prevent Regret.
You see, this explainer isn't just about dwelling on the heavy statistics. We want to pivot toward an empowering, actionable solution here. Because if surgery is your best or chosen path, how can you fight back against that regret? Well, look at this fantastic quote right from the source material. This is a doctor speaking incredibly candidly about preparing patients for surgery. They said, "It depends on how strongly the doctor says it. I used to say it incredibly strongly. If you do it, it definitely has an effect." The medical community knows exactly how to mitigate the worst of this regret, but it requires a real proactive partnership between the doctor and the patient well before the surgery even happens.
And here is that exact protocol mapped out for you. Step 1, you and your doctor decide on your treatment path. Step 2, and this is the absolute game changer right here, you must start pelvic floor muscle exercises immediately, before the surgery takes place. You do not wait until you're recovering, you train the sphincter and pelvic floor muscles in advance. And step 3, you undergo the treatment with a stronger body. By prehabilitating those muscles, patients can dramatically reduce the severity and duration of postoperative incontinence. You're effectively cutting off the primary source of treatment regret before it even begins. How amazing is that? We have covered some incredible ground today, transforming complex subjective data into a clear map of what to expect and, most importantly, how to prepare. But hey, data only tells part of the story, right? Real lived experiences tell the rest. So I want to leave you with this question. What has been your experience with prostate cancer treatment, and what actually helped you avoid regret? Sharing your journey might be exactly what someone else needs to hear right now. It really makes you wonder, as surgical techniques become more precise and targeted radiation technologies continue to advance, will we see treatment regret become a thing of the past in the next decade's data? Thank you so much for joining me for this explainer, and I can't wait to see you in the next one.